to our special feature tonight. Being diagnosed with cancer is a traumatizing experience. There are many who are lucky enough to arrest the cancer in its early stages, but sadly, there are others who only saw the signs a little too late. And talking about that, many men get their diagnosis late, owing to the fact that men rarely talk about their ailing matters. Our very own reporter Dolly Murigi Mbuvi brings you the story of Daniel Thuo Mwanyura, a male breast cancer warrior who was diagnosed with breast cancer late. He is one of the luckiest and shares with us his tough journey.
Safari yangu nilianza 2010.
David Thuo Mwanyura never thought man could get breast cancer until he was diagnosed with the disease. The 64-year-old tells us that he was in shock when he received the news that he was diagnosed with breast cancer in 2010.
Safari yangu nilianza 2010. Ndio nilianza safari ya hii kujua niko na kansa. Kwanza nilipata na uvimbe kwa matiti na ingine ilikuwa kwa shingo. Alafu tena nilikuwa na shida ya mkojo.
It all started with a painless lump in his left nipple that grew larger as time went by. Then came the nipple discharge and occasional chest pains.
Wakati nilienda hospitali, walisema mkojo ndio ilikuwa natafuta pumzi, mahali inaweza tolea pumzi. Nilitolewa hiyo kauvimbe ya shingo, nikatolewa matiti na nikashonwa, nikaenda nyumbani.
Doctors kept on giving him painkillers to treat something they weren't sure about, and Thuo never thought it was anything to worry about. He sought medical help when the skin on his left breast began to increase 2 years later.
Kwa muda wa miaka 2 ndio tena ile uvimbe ikarudi kwa matiti. Ile uvimbe kurudi kwa matiti nilikaa naye kwa sababu bibi alikuwa ananiambia aenda kwa hospitali juu hii uvimbe itakuja kuleta madhara mbaya. Na mimi napuuza tu kwa sababu naangalia kibarua. Sasa nikiwacha kwenda kibarua leo sitapata kitu, au pengine hiyo kibarua kuwekwa mtu mwingine. Kwa hivyo nilikuwa tu naenda kibarua. Lakini wakati mmoja ilifikia tu ile kauvimbe ikaanza kuniuma. Ikaniuma siku ya kwanza kwa sababu sasa ilikuwa kubwa na ingine ilikuwa inaenda hivi. Sasa wakufikia tu jioni inaanza kuniuma. Ikaniuma siku ngapi? 3. Siku ya 4 ndio nikaambia bibi sasa nikikosa kulala kama vile nimekosa kulala hiyo siku 3 nitaenda hospitali.
Approximately 0.5% to 1% of breast cancer cases occur in men.
Cancer is an abnormal multiplication of cells, and they are abnormal because of what? Because they don't observe or they don't respect the normal controls that the body has to control the multiplication of cells. So they multiply uncontrollably until they form a tumor, and since they are still not controlled, they are able to move to other places in the body.
Dr. Anthony Ndiritu, a consultant clinical oncologist at Nairobi Hospital, says that male breast cancer is, however, not very common.
You'll find most men don't believe that men get breast cancer. So even when they have something on the breast, they may not think of it being cancer. So they may not seek health care very, very fast. So they are likely to have the cancer progress more before they go to the hospital to be checked, because they don't, first of all, they don't believe they can get a breast cancer. Men have breasts, and the breasts have the normal breast tissue. It's only that it is not as developed as the one for women, but it is there, and it is also sensitive to the hormones like the one for women. And when you talk of checking for breast cancer, we check for both males and females.
It is not certain you can do anything to reduce your risk, but it may help if we can take caution on how we prepare our meals.
When we are talking about the breast cancer and how one is told to consume a lot of fruits and all that, we don't only talk about fruits, we talk about vegetables. But they talk more about fruits because we don't cook the fruits. So when you take a fruit, when you take it raw, it means you have taken in all the vitamins and the minerals from that fruit that your body require. And that is why fruit are vocalized as a mode of disease prevention or building one's immunity. But all the same, we find vegetables also play a very major role in disease control and even helping a patient or a person even to recover from a disease.
Thuo got hope from a fundraising through a donor which sorted for his treatment.
Weda MPSA nikaambiwa kuanza kutengenezwa ni milioni 4. Na mimi mwenyewe hata wakati huo nilikuwa sijapata hata 1,100. Sasa nikaona sasa nimefika mwisho, nikaambia bibi imefika mwisho, kwa sababu hiyo pesa imekuwa mingi. Sasa mahali nilikuwa nafanya kibarua kwa shule moja, headmaster wa huko alikuwa rafiki wangu sana. Sasa yeye aliniuliza, Thuo, ulienda kwa hospitali? Nilienda. Uliambiwa aje kugharamia hiyo matibabu itakuwa milioni 4. Akaniambia hiyo pesa kidogo sana. Sasa mimi nikashindwa, huyo ananiambia milioni 4 ni pesa kidogo, na hata 1,100 sijawahi shika yangu, sasa itakuwaje? Sasa yeye ndio alishughulika na mimi, ndio akanipeleka Aga Khan. Sasa huku tukaambiwa tufanye harambee tupate 1,400, lakini kwa uwezo wa Mwenyezi Mungu nilipata dona huko. Kwa hivyo nilianza kutibiwa na waliniambia tukianza kukutibu hatutakuachilia. Lakini wakati wa kemo niliamka asubuhi moja tukiwa na bibi, akaniwekea maji nioge, kufanya hivi kwa kichwa, nywele yote ikamwagika. Sasa ikabakia kama hapa unyuso. Yeye alistuka, hata mama yangu alistuka, kwa sababu sasa waliona ni mwisho wangu wa kukufa. Makucha ilitoka. Sasa nikakaa kama nilizaliwa sina nywele, sina makucha, lakini niliendelea kurudi. Lakini daktari alikuwa ameniarifu hiyo shida yote nitapitia.
Although rare, men should also be aware of common symptoms like lumps or swelling in the breast, discharge and skin discoloration around the breast area, pain in the nipple area, irritation of the breast skin.
What are these signs that men should look for to suspect that they could be having a problem with their breast? And some of those things are changes on the skin. The skin of the breast, it may become maybe reddish or a bit darkened. They may have some changes on the nipple. The nipple may be either be swollen or having some rashes around the nipple, or they may find some abnormal discharge from the nipple. You may have the skin having something like dimples, meaning there is something developing under there. And generally, if they feel a lump inside the breast tissue. And remember, for men, they should be able to feel the lump quite early, because the breast tissue is not very big. But because they are not suspecting that, they may not look for that.
The Kenyan government has stepped up in its response to the mounting threat of cancer among its citizens. However, much more still needs to be done.
These treatments are also expensive. So there are a lot of other issues that are taken care of in terms of the psychological well-being of the patient, his family, their socioeconomic status. Remember, these treatments are expensive. They can end up draining all the resources of that family, and the family ends up in problems. And generally now the follow-up, what we call the survivorship. What happens after now you have treated the patient? So you have to keep following them up, because the cancers can recur.
So we have to start thinking of how do we ourselves feed ourselves with that good food. And where you can, take even your vegetables raw. And I know currently, as we are talking about so many things like the GMO foods, we are also talking about the foods that have been spread with the pesticides and all that. So I say, like things like tomatoes that you need to take raw, which are good for the health of a person and even for the male health, for the prostate of the male. I tell people, get the tomatoes that have stayed in the market like for 2 days. Don't go for the ones that are looking very fresh, because those ones might have been plucked before the time that pesticide the duration has expired. But the ones that have stayed for 1 or 2 days, you can comfortably go and wash them. Or alternatively, buy them and then do rotational. Like the tomatoes you buy today, don't cook them today. Cook them after 2 days. And then the ones you bought today, then they would have reached that time, then you'll be able to take them. That way you get the nutrients, and at the same time you are protected from the pesticides that can also be able to trigger cancer in the body or any other lifestyle disease.
Kenya, like other third world nations, struggles with cancer prevention and treatment. Thousands of cases of cancer like prostate and cervical cancer increase every year, and there's still a lot more that needs to be done to create more awareness of this killer disease.
Kitu ya kwanza ni kujikubali. Ati hii nimesikwa na ugonjwa ya kansa, mimi najua tu nitapona. Lakini ukiona kifo utakufa. Kwa hivyo inafaa ukipatwa na ugonjwa amini tu utapona. Lakini hata sio ugonjwa tu ya kansa, hata ugonjwa ingine inaweza kukupata uone tu kama umefika mwisho. Lakini ukiongea na watu, usipokaa peke yako, mkae na watu msaidiane kimawazo, utafaulu.
However, people are urged to show up for screening for early diagnosis.
Na kujikubali, usinyamaze.
David Thuo is a cancer warrior. He's glad to have survived and shares his story, rallying men to understand that breast cancer does not only affect women, but men too are affected. Dolly Murikimbui for Hope TV.